Welcome, everyone. Hello, my name is Becky Sanders. I am happy to welcome everyone to today's event. Thank you for joining us for the Illinois Telehealth Awards. At this time, I'm going to hand everything over to Lisa Mazur, and she is going to take us through today's program.
Thank you so much, Becky, and thank you to the Upper Midwest Telehealth Resource Center for being such a wonderful host. We really appreciate all your support. So thank you everyone for joining us for our annual Telehealth Leadership Award ceremony organized by the Partnership for a Connected Illinois. My name is Lisa Mazur. I serve as the chair of the Partnership for a Connected Illinois and have the pleasure of being the MC for today's award ceremony. So today we will be recognizing 3 extraordinary telehealth leaders: Norwegian American Hospital, Jersey Community Hospital, and our Governor J.B. Pritzker. All 3 of the awards recipients today have made an incredible difference in the lives of Illinois citizens by expanding access to virtual healthcare services during a time of absolutely unprecedented need. We'll start off our event today with a special keynote address from A.J. Wilhelmi, the president of the Illinois Health and Hospital Association. But before A.J. joins us, we would like to give you a little bit of background about PCI in case you haven't yet attended an event in the past. So the Partnership for Connected Illinois is an Illinois nonprofit tax-exempt organization that was formed in 2009 with the mission of ensuring broadband access throughout the state of Illinois. Its goal was to maximize how citizens in Illinois had access to broadband and was responsible for the expenditure of $305 million for the expansion of broadband across 3,600 miles in Illinois. After that grant was completed in 2015, then PCI shifted its focus to the use of telehealth by creating the Illinois Telehealth Initiative. The Illinois Telehealth Initiative conducts educational, virtual, and in-person forums and organizes demonstration projects. And it also has a very interesting digital health data initiative that's currently underway and serves as a neutral, independent, and open source for both inline and retrospective use of research in the digital health communities. During this past year, during the pandemic, PCI held 6 virtual forums with over 1,300 different participants covering the use of telehealth during the pandemic in different settings, ranging from substance use disorder to post-acute and other types of care delivery settings. So with that, we'd like to give you a special thanks on behalf of the board to Nancy Kazak, our fearless and tireless executive director who's led PCI and the advancement of telehealth in the state of Illinois for many years now. She's a resource to all of us, to policymakers, to the lawyers, to the healthcare providers, really anyone that's touching telehealth in Illinois. We thank you, Nancy, for being such a wonderful and consistent resource to all of us. In addition, PCI deeply thanks its wonderful sponsors who have made today possible. We appreciate your support and your leadership. And then finally, another thanks to our Upper Midwest Telehealth Resource Center friends for being our host today, and for Lurie Children's, who has put together a very, very special video that we will show you in advance of presenting the award to the governor. So with that, it is my pleasure to introduce you to A.J. Wilhelmi, the president and CEO of the Illinois Health and Hospital Association. As many of you know, the association represents more than 200 hospitals and health systems in Illinois to help them as they care for their patients and their communities, advocating for sustainable, patient-focused healthcare systems that provide high-quality care and promote healthy local communities. Before serving as the CEO and president, AJ also served as the Chief Government Relations Officer for 3 years, where he was responsible for directing IHA's overall state and federal advocacy and policy agendas. And under that leadership, IHA achieved major advocacy accomplishments, including enacting landmark legislation on hospital tax exemption, expanding Medicaid coverage under the Affordable Care Act, and obtaining new Affordable Care Act access payments and preserving Medicaid funding. So thank you, AJ, for being with us today. and we look forward to hearing your thoughts.
Great. Thank you very much, Lisa, and good morning, everyone. I want to start by thanking the Partnership for a Connected Illinois for convening this event and providing a spotlight for telehealth innovation, policy, and care for underserved populations at such a critical time. The awardees today have risen to face monumental challenges in 2020 by really adopting and adapting with ingenuity to ensure Illinoisans receive critical access to healthcare. And so this spring, I wanted to share some thoughts about some of the data that we've collected. This spring, National Electronic Health System, EPIC, observed a 300-fold increase in telehealth utilization. And to offer some perspective, approximately 45% of the US population is estimated to have their medical record in an EPIC system. And even as in-person visits have resumed, telehealth use has remained at a significant level, 21% in July, for example, reflecting a strong indication from patients and providers that this flexibility must be maintained permanently. Also, a federal report on Medicare fee-for-service primary care visits found that in April, nearly 50% of these visits were conducted via telehealth, compared to less than 1% before the COVID-19 pandemic. However, in May, the number of in-person and telehealth visits combined remained below pre-pandemic levels, even as in-person care picked up again. And similarly, the US Department of Veterans Affairs found that a 56% decline in in-person visits was only partly offset by the twofold increase in telephone and video visits. And we think these data points strongly suggest that telehealth substituted for in-person care without increasing utilization. And so based on a recent IHA survey, over 70% of Illinois hospitals found that telehealth has helped drive a reduction in the rates at which patients missed appointments, what we call no-shows. We know that when patients keep their appointments, we see an increase in adherence to care plans, improved chronic disease management, and downstream cost savings. And this marked decrease in missed appointments demonstrates the potential to improve care, but it also shows us that social determinants of health can present barriers to accessing in-person care. Telehealth can remove access barriers created by social determinants, such as a lack of transportation or geographic isolation from healthcare professionals. And quality analyses from other states and reputable third-party study projections indicate that telehealth coverage expansion can improve access to care by avoiding emergency department visits, hospital admissions, and unnecessary transportation. So with regard to transportation, the Federal Centers for Medicare and Medicaid Services estimated that telehealth saved Medicare patients $60 million on travel annually. And other projections show $540 million in travel savings by 2029. These figures were compiled before telehealth utilization increased under the pandemic. So simply put, the upside of telehealth is enormous. Now, today's recognition of 2 hospitals that have improved care for underserved populations in 2020 is truly representative of how diverse healthcare providers from across the state have overcome obstacles to deliver care to those most in need. Norwegian American Hospital, a safety net provider in the Humboldt Park neighborhood of Chicago, and Jersey Community Hospital, an independent district-owned provider in Central Illinois, have embraced technology as a way to deliver patient-centered care safely and in balance with their in-person services. You'll hear more about the great programs these providers have created in just a few minutes. But I want to congratulate Norwegian American Hospital and Jersey Community Hospital and their CEOs, José Sánchez and Beth King, on their well-deserved recognition today. Congratulations. So early in the pandemic, Governor Pritzker and the Department of Healthcare and Family Services temporarily lifted long-standing barriers to telehealth services by requiring commercial health plans and Illinois Medicaid to allow for the delivery of clinically appropriate, medically necessary healthcare through electronic or telephonic means. Insurers and Medicaid were also required to waive cost sharing for all services delivered by way of telehealth and to lift restrictions that prevented patients from receiving care in their homes. What followed was an immediate seismic shift in healthcare service delivery as patient demand for telehealth services increased exponentially in alignment with the need for physical distancing. Healthcare providers rapidly invested in new technology, adjusted clinical workflows, and educated staff, patients, and clinicians on telehealth delivery. These changes have temporarily reduced social, economic, and environmental barriers to care, like transportation, childcare, and insurance costs. Also, the governor's Connect Illinois initiative has directed $420 million towards strengthening and expanding high-speed broadband, recognizing that access to broadband is a critical component to improving the lives of families and businesses for everything from healthcare to education. Governor Pritzker's strong leadership has resulted in the most comprehensive telehealth policy change in Illinois history, resulting in innovative solutions that remove barriers to accessing healthcare services. Among these policy changes, the simple guarantee of payment parity for clinically appropriate, medically necessary telehealth services when compared with in-person services opened the door for providers to quickly mobilize true patient-centered care. In a recent survey of 150 of our Illinois hospitals, 98% shared that they now offer telehealth. This is a direct result of coverage and payment parity policies driven by Governor Pritzker's administration. And so, Governor, on behalf of the entire Illinois provider community, I want to congratulate you on the well-earned award you're receiving today and for your strong support of telehealth services for the people of Illinois. Just a few more thoughts. IHA's vision for Illinois healthcare is that in order to support each person's quest for optimum health, all individuals and communities have access to high-quality healthcare at the right time and in the right setting. Leveraging technology to ensure patient-centered care is a key component of this vision. Now, according to America's Health Rankings 2019 annual report, Illinois ranks 26th out of the 50 states for overall health. The primary reasons for this ranking are community, environmental, and health policies that can be improved, like mandating telehealth coverage to immediately create better access to care at the right time and in the right setting. To ensure that accessible, safe, and reliable telehealth services continue after the pandemic, there is still more policy change needed. We need the General Assembly to pass legislation on both coverage parity and payment parity with in-person services. Telehealth must be reimbursed at the same rate as in-person care. Now, even before the COVID-19 public health emergency, 36 states had telehealth coverage parity policies, and 16 states had telehealth payment parity for commercial health plans, but Illinois did not require either. In the past, commercial plans have offered limited or no telehealth coverage due to this oversight, with very few offering payment parity. And then for Medicaid, 21 states had telehealth coverage parity policies, and 28 states had telehealth payment parity. While Illinois offers limited Medicaid coverage for telehealth services, there are no laws on the books that direct the Medicaid program to treat telehealth and in-person services the same for these purposes. Payment parity is the linchpin to removing existing barriers to patient access and provider adoption, and it will pave the way for widespread implementation of telehealth. I mean, after all, providers are delivering services virtually that they would deliver in person. Without legislative action from the General Assembly, providers will not have the certainty they need to continue to invest in and utilize new care delivery tools. And Illinois residents will abruptly lose access to the telehealth services they've relied on during the pandemic. IHA is working closely with the Coalition to Protect Our Telehealth, a diverse group of Illinois healthcare providers and patient advocates, in urging the General Assembly to protect innovative telehealth approaches developed by Governor Pritzker's administration, so Illinoisans can continue to safely access critically needed quality healthcare beyond the pandemic. In 2021, there is a significant amount of change and innovation to look forward to. Our hope is that permanent telehealth coverage and payment parity will continue to be a priority of this administration and the General Assembly, so that together we can improve the future health of the people of our great state. I want to thank the awardees today for improving the health of Illinoisans in 2020 through technology, innovation, and sheer ingenuity. Congratulations again on your very deserving awards. And thanks again to the Partnership for a Connected Illinois for your leadership and strong support of telehealth. It's a real pleasure to join you all today. Thank you.
Thank you, AJ, for those absolutely beautiful words and inspiring words. We look forward to all the great things that IHA will continue doing for us in 2021 and beyond. And with that, I would now love to turn the program over to my fellow PCI board member and the CEO of Canary Telehealth, Carla Robinson, who will be presenting the first of the 3 awards for the day. Over to you, Carla.
Thank you, Lisa. I'm delighted to present this award to Norwegian American Hospital. Norwegian is a small safety net community hospital serving some of the Chicago neighborhoods that have been hardest hit by the COVID-19 pandemic. They've been a leader in rapidly implementing telehealth in the spring and summer of this year to continue delivering care to its underserved patient population. Despite a high-need population, funding challenges for the hospital, and patient barriers accessing technology systems, Norwegian American Hospital was able to very quickly and successfully convert many of its outpatient services to telehealth. The result was that while many other healthcare providers have seen a significant drop in overall clinic volume in this year, Norwegian was able to keep its primary care and other outpatient specialty visit volume consistent with prior years, resulting in improved care and reduced barriers to care for its high-need community. The speed of Norwegian American Hospital's transition was one of the most critical aspects of its success. While many other organizations were establishing telehealth plans and protocols in March and April, understandably, Norwegian was already reaching patients and providing care remotely. In fact, quite remarkably, they began their telehealth visits within only days after the World Health Organization declared a global pandemic. Norwegian American Hospital's commitment to maintaining close relationships with its patients and firm belief that prevention and wellness are critical led it to transition extremely quickly to telephone visits to help bridge the gap so as not to miss opportunities for prevention and contact with its patients. They ultimately later transitioned to widely available platforms and ultimately a telehealth specific platform in order to deliver their telehealth services. Although many health systems have adopted telehealth in recent months, Norwegian American Hospital has been particularly successful at using virtual visits to avoid gaps in care for its underserved population. Based on available data, Norwegian American Hospital has not seen any drop in clinic visits thanks to a successful telehealth implementation, the flexibility of its staff, and the entire hospital's commitment to providing care regardless of barriers, even amidst a global pandemic. Norwegian American Hospital has also not yet seen increased non-COVID-19 hospitalizations for chronic conditions that experts feared would be neglected during the pandemic. They attribute this to the rapid and successful telehealth rollout, which ensured that vulnerable patients continue to receive care remotely for these conditions. Norwegian American Hospital's telehealth efforts have ensured ongoing, uninterrupted access to care for a vulnerable community. With that, I'd like to present a video that the hospital has prepared to give you more context for the great work that they're doing.
I am José Sánchez. I am the president and CEO of Norwegian American Hospital. I have the privilege to serve this community for the last 10 years. Today, the majority of our patients are minorities, 50% are Latinos and 50% African American or Black. But we are a community with many different challenges. The hospital is at a critical period given the pandemic, but we have always been here through other major health crises. And then today, here we are dealing with COVID-19.
Norwegian has a long history of meeting the patient's needs even outside of the typical doctor's office. For instance, we have services like transportation and we have services like food to really meet them wherever they are at. So when the pandemic first started, we knew that we had to transition our typical model of care quickly to meet the needs of our patients. The World Health Organization declared the pandemic mid-March, and within days, we had set up systems and structures and procedures so that we could offer our patients telehealth services so that they did not need to come in. We were able to transition so quickly that we never had a drop in patient care. So we went from regular clinic visits to telehealth almost overnight. Many of our patients may not have had access to video on their phone or reliable internet. So we were able to transition to telephone visits because that's what made sense for our patient population. They would reach out to us and said that they wanted to talk to us. They wanted to know and have access to their physicians about how to have the services to keep them as healthy as possible during the pandemic. Over 80% are either Black or brown, meaning that they were disproportionately affected by the COVID-19 pandemic. This means that we needed to keep them in very close contact to make sure that they had the services that they needed. We did this through our telehealth visits. We also did this through outreach calls, checking in on them, following up on any of our patients coming through our emergency department to make sure that they did not have to come in for COVID. We are honored to receive the Excellence in Telehealth Award from the Partnership for a Connected Illinois. Thank you.
Fantastic. On behalf of the Partnership for a Connected Illinois, I am delighted to present the Telehealth Leadership Award for Improved Care for Underserved Populations to Norwegian American Hospital. Accepting this award is CEO José Sánchez. With that, I'll turn it over to José.
Thank you, Carla, and thank you. I am José Sánchez, President and CEO of Norwegian American Hospital. On behalf of the Board of Trustees, Foundation Board of Directors, senior and medical leadership, as well as our entire workforce, I am humbled to accept this 2020 Award for Excellence in Telehealth Leadership for our hospital's effort to deliver innovative telehealth care to our underserved population. I especially want to extend my deepest appreciation to Governor J.B. Pritzker for his strong leadership of the state of Illinois this year, including his swift advocacy of telehealth initiative across our state, especially his leadership in extending COVID-19 drive-through and walk-up testing opportunity to our community. We test over 200 people on a daily basis, and the positivity rate here is about 36%, which is significantly above the state average. In the midst of a pandemic, telehealth is one of the most essential tools we deploy in expanding access to quality health care for underserved populations. And this has greatly enabled Norwegian American Hospital to deliver care and where it is most needed. Our patients are the most at risk group, so we needed to offer healthcare services here in the community that were convenient, affordable, and meaningful to the population we served. Norwegian has a long history of providing services outside our building. We have gone out into the community through a mobile services programs, providing free health care and dental services to our children in the community, providing transportation to patients and their families. We are also providing food for patients in our community suffering from food insecurities. So initiating telehealth services has helped expand our reach to the community even more. Now more than ever, Norwegian American Hospital depends on innovative communications and other electronic data to assist with the delivery of important clinical services beyond our front doors. We also deliver health education and perform advocacy outreach directly to the community through our visits as well. These allow us to screen for food insecurities, social services, and transportation needs as well. Most importantly, through telehealth, we have been able to minimize financial burden and time commitment for our patients, address the fear of the healthcare setting during these challenging times, and ultimately keeping our patients safe within their comfort zone. We quickly adapted and turned around how we delivered our services virtually overnight. Thankfully, we were able to accomplish this without a drop in clinic volume. When other organizations were shutting down their services, we did not have that luxury. We had to adapt incredibly fast so that we didn't lose touch with our patient and our community. Although 2020 has been a challenging year for all of us, I want everyone to know that we remain committed to providing quality, compassionate healthcare to everyone, regardless of their ability to pay. And we are most proud of what we have done and accomplished for the Humboldt Park community. Besides heavily focusing on efforts to reduce the impact of the COVID-19 pandemic, we are consistently raising awareness and on health disparities seen in our community. As many of you already know, minorities are disproportionately suffering and dying from COVID-19 in an alarming numbers in underserved communities with high minority population like ours. So unfortunately, our patient zip code has more of an effect on their health than other genetic codes. Even our children are unfairly affected. 61% of their family are considered low income. Despite the devastation poverty has caused in some of our communities, we are still committed to affecting positive change for Black and Brown minorities throughout the zip code and beyond. Improving access to quality care for underserved minority does not stop at our doorstep. In order to eliminate these deeply rooted inequities, we have combined our advocacy efforts with healthcare leaders, safety net hospitals, social service organizations, and legislative officials. In closing, I want to say that this pandemic has sadly highlighted long-standing healthcare inequities. So implementing telehealth in a community hospital setting has been a truly transformative and rewarding experience this year. Again, thank you for this award. And on behalf of everyone here at Norwegian American Hospital, we are very grateful for this opportunity to share our successes with you. Please continue to stay safe and take care. Thank you.
Thank you very much. Congratulations again to Norwegian. The work you're doing is incredibly impressive. And thank you to Carla for that beautiful presentation. And with that, I'd like to turn it over to my fellow board member and the vice chair of PCI, as well as the general counsel of Lurie Children's Hospital, Fatima Zanzi, who will be presenting the second award of the day.
Thank you, Lisa. Good morning, everyone. It's my pleasure to award to Jersey Community Hospital the Leadership Award for Improved Care for Underserved Population. So Jersey Community Hospital is located in Jerseyville, Illinois, a town with just over 8,000 residents, and serves Jersey, Calhoun, Greene, and Madison counties. Jersey Community Hospital has continued to be an important innovator in using telehealth to serve rural populations and has worked hard to develop critical partnerships with stakeholders in their surrounding area to serve this high poverty rural population. As an early member of the Illinois Telehealth Network, Jersey Community Hospital has built telehospitalist and teleinfectious disease programs to supplement its focus on Primary Plus, which aims to provide robust primary care services, stressing preventative care services and public accountability, while also offering higher levels of care locally. As they have grown this model, their original telehealth projects have multiplied. Most recently, Jersey Community Hospital applied for multiple USDA distant learning and telemedicine grants to start a variety of telehealth projects, including those focusing on maternal fetal medicine, pediatrics, and emergency response services. Recently, they just received a $300,000 USDA telehealth equipment grant announced by Agricultural Secretary Sonny Perdue. During the COVID-19 pandemic, Jersey Community Hospital was able to quickly adapt and start performing outpatient telehealth services, including primary care and behavioral health visits. They were also innovative by switching their chronic care management services to a phone call system. Getting these programs up and running quickly was crucial to providing safe and innovative care to their rural populations. This year, Jersey Community Hospital provided telehealth services for infectious diseases, telehospitalist, pain management, primary care, psychiatric services, and behavioral telehealth consults. And now we are going to show the video that Jersey Community Hospital has prepared.
I'm Erin Cochin, Director of Population Health. I joined the Jersey Community Hospital team 2 years ago after we received our first USDA DLT grant to lead the implementation of the telehealth program. Since then, we have been blessed to receive several more USDA DLT grants, which aided in the purchase of additional telehealth equipment to further grow our telehealth program throughout our organization. Prior to the pandemic, JCH had successfully implemented a telehospitalist program. As the pandemic progressed, we were able to transition our telehealth services to include primary care, behavioral health, pain management, and infectious disease. Currently, we are in the process of integrating a new zero contact check-in process and upgrading our outpatient telehealth platforms to accommodate the needs of our patient population as a result of COVID-19.
I'm Dr. Michael McNair, Chief Medical Officer of Jersey Community Hospital. I've been in practice for over 20 years, and one of the problems we faced here in the hospital was the fact that the primary care physicians would have to come in every morning and try to see their few patients that they had there, and they rush in and rush out, and the nurses never really quite knew when they were coming. Also, we always faced with the issue of the quality of life that the primary care providers had. Being on call at night, weekends, they had to come in and round on hospital patients, as well as they had to take phone calls from the nursing staff all through the night. So these were a couple of the reasons that we were looking for solutions to the hospital program. Another reason was the fact that the quality of care, I think, suffered a little bit. We had primary care physicians that, while they were outstanding outpatient physicians, just didn't really have the experience to take care of inpatient hospital patients as well as they could have. When you only see a pancreatitis once a year or some issues like that, it makes you just not as comfortable taking care of that. And so we looked at several options, but the one we decided upon was to use telehospitalist program. And what this has allowed was really to solve all of our issues with one solution. It improved our primary care providers' quality of life by not having to come in on weekends and round on patients. They don't have to come in during the week now. They can just go to clinic. And more importantly, they're not up all night answering phone calls. They can get good night's sleep and come in the next day and be ready for clinic. And it's just really been a huge benefit to them. Secondly, I think it's been good for our nursing staff. Instead of not knowing when physicians are coming in or not being able to get a hold of them, we've been able to utilize the telehospitalist and the return call rates and I think the ease of use for the nursing staff has just been outstanding. And so that's been another great benefit. And at third, I think the quality of care has been better. We've seen it in our quality metrics, and we've also seen it in a reduction in our readmission rate. And so I think really the telehospitals program was able to solve all of our problems. In the future, we'd like to continue to advance this program. One would be to increase the number of specialists that we have available through telehealth for our inpatients. We'd also like to be able to move telehealth into the emergency room, where perhaps we link with a pediatric hospital to offer ED pediatric patients really a line down to the tertiary hospital, so we can really decide whether they need to be admitted or transferred or that they can go home. And so I think there's still a whole world of telehealth that's open for us, and we look forward to moving into that.
So on behalf of the Partnership for a Connected Illinois, it is my distinct honor to present Jersey Community Hospital with the Telehealth Leadership Award for Improved Care for Underserved Populations. Accepting this award is Beth King, the CEO of Jersey Community Hospital. Congratulations to you, Beth, and to all of your teammates at Jersey Community Hospital.
Thank you so much. I appreciate Illinois Telehealth Network for the nomination today, and we are definitely honored and humbled to receive this award today. I just wanted to share a couple of things. As we started our journey really a few years ago, we developed telehealth as a strategic initiative for the organization. And to do that, we really had to do an IT infrastructure updates across the whole organization. At that time, we also joined Illinois Telehealth Network as a collaborative partner to help us through this path. And we, the entire time, had the full support of our board of directors, which we were very appreciative of. So over the past 3 years, we have received a substantial amount of USDA funding to help us with our equipment needs, which really is highlighted in the video. Our inpatient telehospitalist program is the most significant of those. That did start in May 2019. And then as recent really as last week, we had a kickoff call to expand that program to have intensivists in our ICU. We do have a 4-bed ICU that we have been able to hardwire to have connectivity to intensivists when that higher level of care is needed 24 hours a day, 7 days a week. So we're very excited with that in our partnership with Eagle Telehealth. Really, I'd like to thank the whole team, and without Dr. McNear and Aaron Cochin, our whole telehealth team, our collaboration with Illinois Telehealth Network, none of this we wouldn't be able to provide this higher level of care to our rural community. So on behalf of the hospital, our board of directors, our employees, I'd like to thank you for this recognition today.
Thank you, Beth, and congratulations to Jersey for the amazing work that you've been doing. And we appreciate you sharing that with us. Well, with that, I think we will turn it over to our third presentation, or our final award of the day. It is now my great pleasure and distinct honor to present the final award of the day to Governor J.B. Pritzker. After careful consideration of the many different submissions made by various leading health care organizations in the state, our awards committee unanimously agreed that the governor's efforts to lead our state through the pandemic and expanding access to healthcare services via telehealth made the governor the best recipient of the award in actually 2 different categories. First, the award for policy changes to advance telehealth, and second, the award for advancing telehealth by innovation. Illinois Governor J.B. Pritzker promoted and advocated for improved telehealth policies, laws, and regulations that ensured access to healthcare during the COVID-19 pandemic. We heard wonderful examples of how that coverage and those policy changes today have been implemented by Norwegian and by Jersey, and as AJ explained, by many other stakeholders in the state of Illinois. That executive order allowed for regulatory flexibilities that accomplished many different important things. For example, it allowed patients to receive treatment in their homes without having to travel to medical facilities. It reduced the need for scarce and important PPE. It created a greater level of engagement between patients and their clinicians. And it decreased cancellations and no-show rates and enabled healthcare providers, when possible, to provide care from home, which was important for infection control purposes. As we know, and as AJ explained, we just saw a rapid explosion in the amount of telehealth, particularly in the mental health space, where we saw providers doing about 10% of their visits via telehealth to about 90% after the executive order. And telehealth use in Illinois has maintained a rather significant and persistent level of use, with strong indication from both the patients and the providers in the communities that this flexibility was critical to providing access to care and should be maintained permanently. I will never be able to do justice to the impact of these changes, and Lurie Children's kindly put together an absolutely beautiful video that lets us all hear from the patient's perspective why these changes were so critical. So with that, we'd like to show you a short video prepared by Lurie Children's.
Hello, Governor Pritzker. My name is Yelena Lopez. I am 16 years old and I live in Berwyn, Illinois. I'm currently a junior at Morton West High School and a volunteer with Forget Me Not Rescue. At the age of 3, I was diagnosed with muscular dystrophy. I had been a patient at Lurie Children's Hospital for about 14 years now, really long time. Lurie Children's is so important to me, and the doctors and nurses I see always have gone the extra mile to help me and my family. I see about 10 different specialists and care teams. I am enrolled in the Medicaid program, and it has been a lifeline for me and my family. The safest way for me to receive ongoing care is through telemedicine. I am so hopeful that telemedicine can continue even after the pandemic. Besides keeping me safe, along with everyone else, one of the major benefits is that I don't have to miss an entire day of school due to my doctor's appointments. Governor Pritzker, we are so proud that you are receiving the Connected Illinois Award for Excellent Telehealth Leadership today. Mousy and I cannot think of a more deserving person to receive this award than you. Thank you for being a great champion for child health and moving telemedicine forward in Illinois. Congratulations, Governor Pritzker. On behalf of all children in Illinois, keep up the amazing work.
Thank you. And with that beautiful message, it is our distinct honor and pleasure to present you Governor J.B. Pritzker with the Award for Advancing Telehealth in the state of Illinois. With that, Governor, we would love to give you the opportunity to say a few words. You have time?
I do. Thank you so much, Lisa. And I mean, very kind introduction, and for all that you do and your team do to advance telehealth access across the state. It's really an honor to be recognized by the partnership, and I look forward to all that lies ahead as we work together to make these services possible for even more Illinoisans. And thank you to Lurie Children's Hospital, and especially to Yelena and Mousy for sharing that story. I am so glad to know that your care has not only remained consistent, but become all the more convenient in these recent months. I also want to recognize the Illinois Health and Hospital Association, especially its president, AJ Wilhelmi, for all that his member organizations have done to save lives in this pandemic. And AJ and his team really have gone above and beyond, and it's made all the difference. Let me congratulate my friends at Norwegian American Hospital and Jersey Community Hospital. I want to thank you from the bottom of my heart for being ahead of the game in advancing telehealth in your communities, supporting your COVID-19 patients and drop-in patients alike. With experience in business and technology, I've long understood that telehealth is not just the next frontier in flexible healthcare, but in accessibility to healthcare, of course, too. The ability to access care over the phone or over a video stream makes a world of difference, especially for our rural communities, for single-person households, for those without a vehicle, and for many families who live far from their primary healthcare provider, or those who don't have any provider at all. All that said, the earliest projections of the COVID-19 pandemic made the necessity of telehealth all the more clear. Reducing travel and community exposure, reducing the need for personal protective equipment, ensuring that in-person care was reserved for those who most needed it, and allowing healthcare providers to treat patients from quarantine themselves. So I was proud to prioritize advancing telehealth access early in our fight against COVID-19 by signing an executive order to expand telehealth access in our state Medicaid program, and by requiring private insurers to reimburse telehealth at the same rate as in-person appointments with providers, all while increasing the methods and services available in the Illinois telehealth sphere, including therapy appointments, wellness checks, behavioral health care like addiction treatment services. These are all things vital to a person's well-being. So it's essential that they be allowed to continue uninterrupted during this crisis. We added more kinds of technology that can be used for telehealth. Today, a patient can receive services with their tablet or their smartphone. FaceTime or similar systems work too. But for these rule changes to make a meaningful impact, they require a change in behavior. And I have to say, I was incredibly impressed by the willingness of our healthcare community to implement telehealth initiatives so quickly, while also shifting all of their services amidst this pandemic. Looking at our state Medicaid reimbursements alone, between March and May of 2019, that's a year before the pandemic, we paid out just short of $200,000 in telehealth services. For that same period in 2020, the total was $17.9 million, 90 times higher. I also want to specifically recognize OSF Healthcare, the Southern Illinois University School of Medicine, and Advocate Aurora Health. These three institutions in particular were our state partners for the remote patient monitoring program that we launched in early April to further expand telehealth services in response to COVID-19. More than 200,000 calls have been made into this program since its launch. Of those, more than 30,000 participated in full virtual visits, while more than 10,000 utilized the full pandemic health worker remote patient monitoring program, which includes consistent monitoring over 2 weeks, and most often a wellness kit delivered door to door that includes a thermometer, a blood pressure cuff, a pulse oximeter, and disinfecting alcohol wipes. I'm really glad and thankful to all of the providers across the state who made this progress possible. It really couldn't have come at a more critical time. But as far as I'm concerned, this award is just one of many milestones in our telehealth expansion journey, and we'll experience that journey together. Our work is far from over, and it starts with ensuring that everyone in Illinois has the tools to plug into telehealth. I've set the ambitious goal of bringing broadband digital infrastructure to every corner of Illinois by 2024 through our Connect Illinois program, the largest and best crafted state matching grant program for broadband development in our nation's history. We've launched $100 million already in capital this year through Connect Illinois, which was founded with the mission to spur economic development, to expand opportunities for e-learning, and of course, increase access to telehealth. Norwegian American Hospital, Jersey Community Hospital, and so many other providers have demonstrated a dedication to bringing telehealth to the people they serve. Connect Illinois will make it so no community is left behind in this work. Or in the words of the partnership, we'll leave no stone unturned in the mission to secure advanced health and prosperity for the people of Illinois. So thank you all again for this very kind recognition. And Lisa, I'll turn it right back to you.
Thank you, Governor. We are incredibly lucky to have your leadership. You understand these issues and you embrace them, and the changes that you've made have made such a meaningful impact on so many patients throughout the state. So it's with our distinct honor to present you with this award and to thank you for all that you do and will do in 2021.
Thank you very much. Thank you.
Thank you. Well, with that, I believe we'll be concluding our program for the day. We'd like to give a thank you to the Upper Midwest Telehealth Resource Center for hosting us all today and for helping to organize the event. Another thanks to Nancy Kazak, our Executive Director, who really is the leader behind the Illinois Telehealth Initiative and is a friend to everyone in the telehealth industry. And then also to our sponsors who made this event possible today. We thank you for your support. And with that, on behalf of the Board of Directors and the Awards Committee of Partnership for Connected Illinois, we wish you and your families a wonderful holiday season. Thank you, everyone.